Hi, it's Gary Chimes from Lake Washington Sports and Spine, and we got some more ooze for everybody here. So this is some fluid I took some from a patient's shoulder cyst, and this is some Lipogems that we have left over from our procedure we were doing earlier. So this fluid, I'm really excited to see what it looks like when we take it out. So I have a patient who has a rotator cuff tear. So the rotator cuff tendon is going to be providing stability. The patient has a partial tear, which allows fluid to escape from the joint. And in his case, it was hanging out underneath this ligament that sits right here called the coraco-acromial ligament. And so just pulling that fluid out gives him better range of motion. So I'm curious what this fluid looks like. So let's get up close and see it. I'm expecting it's going to probably be pretty darn viscous. Yeah, and you can see it's not watery, it's definitely like a real thick gel. So if you can imagine taking this much fluid out of your shoulder and how much that's going to make it have an improved range of motion. Now, I think that this patient, and we've talked about it, he's probably going to be going towards Lipogems for his treatment to help the rotator cuff tear, but just at least as a way of buying him some time, getting some greater mobility, that's where we're going. Now, this is Lipogems, where we've taken some fat off of a patient's midsection and micronized it, and we have a real active guy who has injuries in both of his hips and a labral tear in his shoulder. So this is just some leftover, and so you can imagine we're putting this into his joints, and just a real viscous fluid, and that's going to help to coat the margins and the membranes of the tissues where he's having, it's just thick enough. I'm not even getting it out of the out through the smaller needle here, so it's real thick, and it's going to help coat the joint surfaces. And I anticipate in about 6 weeks he's going to be feeling great. So taking fluid out, putting fluid in, that's what we do here at Lake Washington Sports and Spine. See you later.